It is now our pleasure to introduce someone who has made good things happen for her son by hard work, thinking big and dreaming bolder. Ladies and gentlemen, I give you Caroline Tomlinson.
Okay, so let me have my first slide. My name is Caroline Tomlinson. I'm from, it's not often I say this, I'm from the south. I usually tell everybody from the south of England, I'm from the north, so I get really confused when I come this way. But I guess what I'm really going to talk about today is our journey that we've had in England. I'm from Lancashire, a place called Wigan that some people may or may not have heard of. And really, I'm going to try and give you a bit of a flavour of our story and the things that have happened to us over the last few years, the last 7-8 years where Joe's been in control of his life. So let me introduce you to my 3 children. That's the picture on the screen over there. You can see Joe on the left, Rosie in the middle, and Jacob on the right-hand side. It's a picture that was taken quite a few years ago, but Joe's now 22, Rosie's now 18, and Jacob's 13. And I guess why I've got involved in some of this stuff is when Joseph was about 6 months old, he contracted meningitis, which left him with a huge range of complex disabilities. I guess one of the things I would describe to people that it was like waking up in a place that we never knew even existed, a place that I would describe as service land, where it feels like things are done to you rather than with you. And as Joe started to get older, it felt like he was a round peg in a square hole. And really, people were moving him from pillar to post. And we really kind of didn't know, I guess, what the best options and choices were because we didn't really have the information. But what we knew was that Joe could only really get the best support he needed if it was the support that was actually created around him. And I suppose that's what we tried to strive for. But before you can set off on your journey, some stuff you have to really understand is the history of where you've come from. And I guess something to remind ourselves, which people have alluded to this morning in talking, is really thinking about this country and thinking about where and how things have evolved in terms of the service system and actually what that actually means for us as individuals these days. If we take ourselves back to the First World War, I'm sure nobody in this room remembers the First World War. You all look very young and sprightly. Taking back where we didn't have a welfare state in this country. We sent our men out to fight the war. Many of those people returned our heroes. Of course, we know many of those people didn't return. The other thing that we also know is many of those people came back with limbs blown off, with disabilities, the group of people that our children never learn about at school. And in those days, we didn't have a support mechanism for those individuals. So what we decided to do was to reserve the most affluent streets in our cities to allow those people to beg with their caps in their hand. And that's where your terminology, handicapped, actually evolved from, hoping that we don't necessarily use that these days. We then had the Second World War, and we created the great British welfare state. And we could have a conversation about that as people sat around the table today. How good or how great is the great British welfare state? And some of us would fold our arms and we'd moan and we'd say how long it took for that doctor's appointment, how long you waited in the waiting room at the hospital, and we could all grumble. And then somebody could walk through the door from Australia, from Canada, from the United States, or anywhere, I guess, and say to us, you don't know how lucky you are. We have one of the most best, I guess, greatest welfare states in the whole of the world. The problem with it, it's too damn complicated and difficult to navigate your way through. It is complicated. So you almost as an individual or a family member seem to have to become an expert in all these different areas, things like the benefits system, having to describe the worst possible day of the worst possible week of the worst possible year to be able to get benefits. People keep moving the goalposts for us all the time. And really in terms of thinking about, do I meet the eligibility criteria? Certainly a conversation we were having in the workshop that I was in this morning. So the question we need to really think about, is the welfare state fit for purpose in this modern day society? Because how many people have never seen that Google logo before? How many of you've all seen it, I guess? Nobody's jumping up saying, I've never seen it. If I'd have come into this room and asked you that about 10 years ago, or asked the question of how many of you use computers, probably quite a few of you would say, oh no, that's not for me. But certainly computers, technology, the internet has revolutionised our lives. And if you like, other industries have had to evolve and develop in a way that makes sense for people. So just think about the holiday industry. 10 years ago, 80% of the British population used to walk into a travel agent's to book their holiday. Now only 20% of people actually do that. And that's because we're all creating our own individualised, bespoke, personalised holiday, if you like. And the question I would pose across the country, if that's really important for people to go on holiday, what would be important for you if you needed support in your life? Be it support for 24 hours, 7 days a week, or support on a more minimal level. And then the questions that we were kind of posing, I guess, in England and trying to work out what some of those answers are. So when I talk about who are the people that need support, well, there's a whole variety of people right across the country that need support, from individuals with learning disabilities, mental health issues, older people, a whole range of different folk. And we often think that this world's about the people over there, but actually this world is about us. What would you want at the age of 96 if you needed some support in your life? Who would want to go and live in residential care? And I asked the question to many people across the country, who would like to live in residential care at the age of 96 when you need support? Very few people jump up and shout, me. And when I've asked these questions to lots of different people, there's actually only been one gentleman that stood up and said, I'd like to go and live in residential care. And I probed him a bit further, and he confessed that he happened to own a residential care home, which is interesting, isn't it? So I guess for all of us, what we need to be thinking about is what is it that we would want should we require support for ourselves or somebody we love and care about? And that's the journey that I've kind of been on. Okay, another big issue that we had conversations in our workshop about was this thing about the money. The thing about the money that in terms of the public sector is extremely tight at the moment. Everywhere you look, people are tightening their belts, saying things like 25% of cuts are going to happen. The big issue is thinking that money has always been an issue. I think if somebody delivered a truck full of money, of course we'd grab it off them at the front door. But do we really actually spend the money that we've got in the best possible way? Some early research that we did in England around In Control and Simon Duffy's work was to actually look at how much is being spent on social care really has direct impact on individuals. And the interesting factor that came through was 40 pence in every pound spent on adult social care in England gets spent on back office systems, administration and bureaucracy. Meaning the people on the front line, the people who need that support, aren't necessarily benefiting from the whole of that pound. And so when people are saying money's tight, well, have a look at what you're spending already and maybe start to look at getting rid of some of them very difficult systems to work our way through and actually make more money go directly to the individuals and the people. Because what's very evident is a lot of knee-jerk reactions have been taking place to people who they consider not as high a level of need. But what will start to happen if you don't give people that low level of support, they will come back into the system in a critical situation. So we really need to join forces together to actually say preventative work is far better than dealing with a crisis. Okay. So we're just thinking about some of the stuff around what this actually means to individuals. And this sort of thing about citizenship and about being a person is an interesting concept that we started to evolve and push, certainly in Wigan, in the early days in 2003, where we actually started to evolve the idea of In Control, the organisation, but more importantly, trying to think differently about the way that services actually work. In England, in 2001, we'd had something called Valuing People, the White Paper. You had a version called something different in Scotland. I can't remember what it's like. Same as you, something like that. You had that there. For me, I had a son approaching this thing called transition. My son was about 14, 15 at the time. He was heading towards this thing called transition, where it's about a child moving from being a child towards being an adult. And we seem to struggle as a nation in trying to get this stuff right. For us as a family, it felt like we were heading towards the edge of a cliff. You didn't know if you were going to fall into a big black hole, or somebody would give you a parachute and you'd fly off into adult social land and everything would be fine. The question I always ask the system is, why is it so damn difficult to get this stuff right? They had known my son had a complex disability from the age of 12 months old. They'd had 17 years to plan some of this stuff. And even today, we could go around the UK, we could go and ask people who are about to leave school this time, who don't know what's going to happen in the next few weeks. That is absolutely unacceptable, and it is ridiculous, and we need to sort some of this stuff out. Fortunately, in England, we started to have some of those conversations on a very small basis. We'd had value in people, and you sit there, we were promised it was going to revolutionise services for people with learning disabilities, it's going to make a big difference. And so I sat and I waited for the change to impact on us as a family. And of course, I could have sat there for a long, long time, because the only way I would judge if the change makes any difference, if it makes a difference in our front room. And really all that I saw happening was people setting up learning disability partnership boards and having lots of talking shops about what could be, but where was the real action? I found out that there was a regional partnership board happening in the northwest of England where I'm from, and I found out that a guy called Steve Jones, who happened to be the chief executive of Wigan Council, was chairing that group of people, that board. And I went along to there and I spoke to Steve and I said to him, never mind trying to change stuff across the region, you need to go and look in your own backyard, because I'm telling you, it's a bit of a mess. And he asked for more information, and eventually we got together, we got a group of folk to help us work out what could the system look like if it was far more person-centred around that individual person. Got a great group of people to start to design a new way of working. Steve agreed to trial it out with 15 young people. One of those people was Joe. So he was one of the first people in certainly England to have theoretically a personal or an individual budget. And we modelled that on the concept designed by Simon Duffy around the keys to citizenship. The first thing and understanding was about people having self-determination. Understanding that you can have choice and control in your life, but it's up to you how much choice and control you want to take. They made a big mistake in England a while ago, thinking that as they started to roll this out and mainstream it, that everybody would want to employ their own staff, and that actually is not the case. Why would you want to employ your own staff when, if you don't have to? If there were good provider organisations providing the stuff that you needed, maybe that would be a better option, and that's what we're starting to see. But understanding the more choice and control that you take, the more responsibility you may have. The next thing was people thinking about having a sense of direction, planning for the future, being able to plan for my son's life when he left school. Then what would happen? Where was he going to live in the future? Who was he going to live with? Being able to plan things like what he was going to do all day and who with, and all them sorts of really dreamy thinking around possibility. I guess the other big question that I was really thinking about was what was going to happen in the long term. What was going to happen to Joe when we were no longer around? Because what we know across the Western world, we have a massive amount of people, great, for the first time, I guess, in numbers, and a huge amount of numbers of people with learning disabilities who are likely to outlive their family members. The questions I ask is what's going to happen when me and my husband are no longer here, and how we can actually plan to create a sustainable future for Joe. The next thing is about money. It's about money for one in terms of the support that Joe needs, but also we all need an income. How is he going to get the money to actually pay the day-to-day bills? Where is that going to come from? Have we maximised his benefits? Could employment be an option? And thinking about all those different things. Where people live and who they live with is absolutely crucial. What we knew across England was that many people with learning disabilities have to live with people they've never chosen to live with. I don't know about any of you that have been on holiday with somebody you thought were all right, so you went on holiday with them. And then at least you think, well, I'll not do that again. For many people who end up living with people they've never chosen to live with, if that situation starts to break down, it can take years to move people on and to get them out. So be able to plan for some of that stuff was absolutely crucial. The next thing was around support. Support being provided in a very person-centred way, in a way that was wrapped around Joe that made sense for him. The biggest issue for us was having some choice about who was supporting him, but also having continuity of support as well. We were sick and fed up of lots of different people coming into our lives. And then I guess the biggest thing is about thinking about community. How was Joe going to contribute to his community? How was he going to be included and involved in his community? But understanding, and really thinking that the biggest issue most people will actually face in this country is isolation and loneliness. When you become isolated and lonely, you become unwell. So how are we really going to think about intentionally creating relationships around Joe that will retain sustainable for the rest of his life? Okay, so Joe's little story starts, quite a few years ago. I've told you about what happened in the early days, but by the time Joe was 12, the system decided that no longer they could support him in the average special school in our locality. We were holding to a big meeting to tell us that now Joseph would be going to a school out of the borough, a good hour's drive out of the borough, something that I would describe to a special school. But one of the things I would say was that there was nothing special about that special school. The only thing that was really special was the authorities seemed to be spending an awful lot of money. In fact, over £60,000 a year was being spent on his support at the school. Did that support work? No, it didn't really, because what we started to see as Joe started to go to school, he became very unhappy with that journey that he started to attack his escort. He started to attack his escort because Joe doesn't use words to speak, so he was expressing how he was feeling, I guess, on that journey. We were brought into a big meeting held by the professionals, all to sit around this boardroom table to say this could not continue because it was becoming very, very difficult. It's almost like you as the family are doing the nipping and the biting to the escort, you feel like it was your fault or you're setting Joe up to do it. The biggest issue then that they came up with was, okay, a solution. We'll put 2 people in to support him to take him on that journey. And very quickly, as that started, very quickly Joe started to express his unhappiness to both of those escorts in the way that he did. Another meeting was soon held, and then another solution was sought. Let's get a big vehicle, let's put Joe at the back and all these people at the front to support him. They were coming up with the wrong solution because they simply didn't know what the problem was. When we really looked into what the issue was, we found out that when Joe got to the school, he couldn't predict the person that was going to be supporting him all day. And therefore, he was expressing that real anxiety, if you like, about going to that school. The thing at home, though, was our experience in terms of the social care system. One of the things I want to remind people who may work in the service system is to actually think about this concept, I guess, of the gift model. We're often offered the gift of services, and my goodness, if we got to be eternally grateful of the gift that's offered. Quite often, we haven't questioned some of that stuff in the past. Another thing I want to remind you of is that I've never met an individual yet or a family member who jumps out of bed one morning and shouts, "I'd really like a social worker in my life today." If we could do without them, we damn well would. But sometimes you get forced into a situation where you need some help and support from the system. You go with your cap in your hand and you beg for some kind of services. You have to jump the hoops of eligibility and really to try to prove how disabled you are and all the things that you can't do. We were eventually offered, through jumping all the hoops, some home care domiciliary support, somebody that would come in to provide some personal care to Joe in a morning. And so we were eternally grateful of that gift, and that's what we started to do. Eventually, you start to realise that people come in and doing that job, many of those people work part-time. Many of those people went on annual leave. Many of them went on training courses. Many of them got so fed up with the job themselves, they left and went to work in the hospital or somewhere else. It really wasn't working for us on the receiving end, neither was it working for these individuals actually trying to do the best job possible. After about 6 months, however, we decided, and really I had a major shock that made me really think about, does this system really work for people? It was a Saturday morning. I'd gone out on the Friday night. I'd negotiated with my husband that I would have the lie-in on the Saturday morning. You know, ladies, where you're lying in bed, you're listening to what's going on, but you refuse to get up. And so my husband gets up and he lets the first person into the house. And he goes into the kitchen at the back, and Joe needs 2-to-1 support. So I thought, well, the first person's here, I can nod off. I'd nodded back off in bed. The next thing, I was awoke with a start, because the next person who was coming in to support Joe had come up to the top of the stairs, but instead of turning right, she turned left. The next thing, she stood at the foot of my bed, asking me how I'd like to be showered. As you can imagine, I jump out of bed and I go wild at this woman, saying, "What the hell are you doing in my bedroom?" And after a great kerfuffle, and as we all calmed down, she said to me, "You know, I'm really sorry." She said, "I was told to come here. It's not usually on my patch. I was supporting Joe. I knew nothing about him. All I knew was the address and his name. I didn't know if he was male or female. I didn't know how old he was. I didn't know what support needs he required. And therefore," she said, "I didn't know anything about him at all, but was told you'd be okay because it's a double up." And at that point, I thought to myself, does this system really work for Joe? Does it work for the many people like him? Because one thing that I did was look at how many people had come into our house providing that intimate personal support. And one thing that they'd all done of great continuity was signing their name. And so I counted up the names of all those different people. The answer to that was 46 different people had come into our house to provide intimate personal care to our son. 46 different people brushing his teeth. 46 different people feeding him his breakfast. If that was a human service, it was being provided in the most dehumanizing way possible. But interestingly, each one of those people crossing our threshold was costing in the region of £15 to £18 an hour. So don't be fooled when people say they're spending the money in the best way possible. Our evidence showed that indeed they weren't. And so what we wanted to look at was actually saying, when we had these discussions with Steve Jones, he said, well, maybe you could start to work out a different way of working. A couple of rules, he said. You can have the money up front and get people to think about how they would plan and spend that money. But rule number 1 is you're not allowed to spend any more money than the state currently spends on individuals. And 2, you can only spend that money in a way that makes sense and isn't illegal. So what we were talking about here was placing Joe in the centre, looking how much the state already spent on him, and trying to plan that in a way that made sense to achieve positive outcomes for Joe. So what we sort of started to look at was a wider range of things as well, because we needed different people to help us. We needed to think about all those different people in those different places. The biggest pitch that we were trying to work towards was creating a sustainable future for Joe when we were no longer here. The evidence shows that when you map out this stuff, and this diagram may be familiar with some people, is that the outer circle, that red circle, actually, if you started to plot out who was in people's lives, what you often find for people with learning disabilities as they get older, that they significantly, the only people they have in their life are people who are paid to be there. Imagine that if that's all you had in your life. And what we needed to create was more opportunities for Joe to participate, then he would meet more friends. The circle in the centre is the circle of intimacy, where Joe himself may place his parents and maybe his siblings there, but who are going to replace us in the longer term? You can see the difference. It speaks for itself in terms of giving Joe a good life. I guess the difference it's made for his siblings, they can see that they're not going to have to take practical responsibility for the brother for the rest of their life, because aren't they entitled to a good life too? I think the biggest difference that it's made is that it's made a huge difference to our community. People know who Joe is, and will look out for him. And you might think that that is ridiculous and it doesn't happen, but it's true. We can give you loads of examples, and that's the stuff that will carry on for the rest of his life and enable him to live a good life, hopefully, for the rest of his life. So it was the beginning of a story that's influenced, I guess, stuff right across England, across the UK, and now internationally. The thing is, you've got to be dead careful that when government get hold of this stuff, they don't turn it into something that it's not. It's got to be owned and driven by individuals and their families. Thank you.